Hey everyone, and welcome to The Explainer. Today, we're diving into something that literally affects hundreds of millions of people, yet it's still one of the most misunderstood concepts in modern medicine. We're talking about measuring body weight. I mean, we've all stepped on that scale at the doctor's office, right? But today, we're going to look really closely at why relying on that one simple number might actually be completely failing us.
So this leads us to a massive question. Is our entire definition of obesity fundamentally flawed? For decades, doctors, policymakers, and, everyday people have relied on one universally known metric to define health and weight. Yep, the body mass index, or BMI. But what if this single number is actually steering modern medicine in completely the wrong direction? What if the way we diagnose and categorize this condition is leading to huge misdiagnoses and basically failing to get care to the people who actually need it?
Okay, let's dive into this. Professor Robert Eckel of the Lancet Commission hit the nail on the head. He said, relying on BMI alone to diagnose obesity is problematic as some people tend to store excess fat at the waist or in and around their organs, and this is associated with a higher health risk. This right here gets to the core paradox that global health experts are finally recognizing. Think about it. A person can have a high BMI, but if their body stores that fat safely, they might be perfectly healthy. On the flip side, someone with a lower BMI might be harboring really dangerous fat right around their organs.
Which brings us to Section 1. The problem with BMI. Why a number isn't a diagnosis. Historically, the medical community has relied heavily on a strict BMI cutoff of 30 for behavioral interventions. Basically, if you hit 30, boom, you're diagnosed with obesity and prescribed treatment. If you're at 29.9, well, you're just overweight. It's an incredibly black and white approach to a really complex biological reality. Because at the end of the day, BMI is just a math equation. It's literally just your weight in kilograms divided by your height in meters squared. That's the whole shebang. And sure, while it's a super useful, low-cost screening tool for looking at massive populations, it completely ignores how our bodies actually function on an individual level. It doesn't measure direct fat mass, it doesn't map out where that fat is distributed, and most importantly, it tells us absolutely zero about your actual organ health.
To really understand this, we have to contrast the cosmetic idea of fat with the actual clinical danger of visceral fat. You see, excess fat stored just beneath the skin, like in your arms or legs, doesn't pose the same health risk. It's relatively safe storage. But fat stored deep inside the body, sort of wrapped around your vital organs like the liver, heart, and muscles, that actively disrupts how your body works. So you could have a person with a BMI of 32 whose fat is stored entirely beneath the skin. They could have perfectly normal organ function and absolutely zero symptoms of illness whatsoever.
Moving on to Section 2, Redefining the Disease, the Clinical Paradigm Shift.
Because of these glaring flaws with the BMI scale, a global commission formed by the Lancet Diabetes and Endocrinology and King's Health Partners, which by the way brought together 58 leading experts, recently proposed a groundbreaking new framework. They want to radically overhaul how we diagnose this condition. First up, they define preclinical obesity. This is a situation where an individual has excess body fat, but entirely normal organ function and absolutely no ongoing illness. Do they face increased future risks of developing something like type 2 diabetes? Yes, for sure, but they don't currently have a chronic disease. Because of that, they don't necessarily need aggressive, time-sensitive medical treatments right this second.
But then, on the flip side, we have clinical obesity. And this is true active disease. To be in this category, it requires objective signs or symptoms of reduced organ function. We're talking about things like obesity-induced heart failure, breathlessness, or severe joint pain that actually limits your day-to-day activities, like bathing and dressing. In this case, the excess body fat is directly causing bodily dysfunction. These folks are suffering from an ongoing chronic illness and they need immediate, appropriate medical management.
So you might be wondering, how do we actually diagnose this without just staring at a scale? Well, experts now highly recommend pairing BMI with specific body size measurements. Taking a simple waist circumference, a waist-to-hip ratio, or a waist-to-height ratio gives doctors incredible insight into that dangerous visceral fat we talked about. Or, if you want the absolute most accurate diagnosis, doctors can use direct body fat measurements, like a DEXA scan. We are finally moving beyond the scale to look at the actual patient sitting in the exam room.
Let's turn to Section 3, a growing global crisis, the scale of the epidemic.
So the crucial point is, while our diagnostic tools are definitely getting more refined, the public health challenge itself is just exploding across the globe. 1 billion. According to the World Health Organization, over 1 billion people, that's literally 1 in every 8 people globally, are living with obesity today. And it's not just an adult issue either. The rates are climbing at a super concerning pace among children and adolescents worldwide.
And this brilliantly illustrates a major misconception. There's this common assumption out there that obesity is strictly a rich country problem, but data from the World Obesity Atlas totally shatters that idea. A staggering 78% of global deaths attributed to high BMI happen in adults in low and middle-income countries. Compare that to just 22% in high-income countries. It turns out the poorest populations, who often lack access to responsive health systems and affordable healthy foods, are actually the ones suffering the highest rates of early disability and death.
Now, what's even more fascinating, and frankly a bit alarming, is how this connects to our environment. Rapid economic development doesn't just correlate with a rising BMI. It simultaneously tracks right alongside rising greenhouse gas emissions, booming urban populations, and way more plastic waste. We are looking at a direct, undeniable link between planetary health, our commercial environments, and human health. It's all connected.
And you know, the financial toll is just equally breathtaking. $3 trillion. That is the estimated annual global economic cost of obesity predicted by the year 2030. To put that into perspective, that massive number encompasses the skyrocketing healthcare costs of managing the condition, treating related non-communicable diseases, and huge losses in productivity worldwide. It really just hammers home the sheer urgency of this crisis. We literally cannot afford to keep treating this the wrong way.
Which brings us to our final section, treating the actual disease, moving beyond the magic pill.
Okay, so now that we understand this new diagnostic framework and the massive scale of the crisis, we have to look at the modern treatment landscape. By differentiating between just having excess weight and actual clinical illness at the individual level, doctors can stop overdiagnosing and start allocating resources in a way that actually makes sense. So if someone has preclinical obesity, the goal is risk reduction, right? Mostly through health counseling and monitoring. But if they have clinical obesity, the goal shifts entirely. Now it's about regaining lost organ function through active, evidence-based treatments. That could mean intensive lifestyle changes, medications, or even bariatric surgery.
Now, we obviously can't talk about evidence-based treatment without mentioning the absolute breakthrough of GLP-1 therapies. They are a real game changer. Clinical trials are showing these medications can yield an incredible 15 to 25% weight loss, offering a seriously efficacious pharmaceutical option for adults with obesity. However, and this is a big however, the World Health Organization is very firm on this point. Medicines alone cannot solve a complex societal challenge. Obesity isn't just an individual failure, it is an environmental symptom. Let's move to and see how this builds into the WHO's comprehensive three-pillar strategy. Because to fundamentally reorient our approach to this chronic disease, we have to do a few things. First, create healthier environments through robust population-level policies. Second, we've got to target our screening and early interventions, identifying those high-risk individuals using the right metrics, not just BMI. And third, we must ensure access to lifelong, person-centered care that treats the whole patient, not just the number popping up on the scale.
To actually put that strategy into practice, the WHO has outlined an acceleration plan with some really specific multi-sectoral interventions. We're talking about regulating harmful food marketing that targets kids, implementing pricing policies that actually make a healthy diet affordable for everyday people, completely overhauling school nutrition programs, and properly integrating both prevention and management directly into primary care. It's basically a full, coordinated societal push to finally address the environmental roots of this epidemic.
I want to leave you all with a final, provocative thought. If we stop treating a number on a scale, can we finally start treating the patient? The science here is just incredibly clear. BMI is an outdated, incomplete metric that has fueled weight stigma and driven a wedge into patient care for way too long. But by adopting a nuanced, clinical understanding of fat distribution and organ health, we can end the misdiagnoses, we can lower those staggering global costs, and most importantly, we can actually provide compassionate, effective care to the people who need it most. Thank you so much for joining me on this explainer. Keep asking questions, keep looking beyond the scale, and I'll see you next time.